40-year-old woman notices increasing lower abdominal distension with no pain. On examination, a lobulated cystic mass is felt and seems to be arising from the pelvis. What is most appropriate investigation? So the choices are mostly screening tests, and for a mass arising from pelvis, it would be CA 125 for ovarian carcinoma. Early symptoms can be vague like abdominal distension or a mass. Generally it is painless. And a late sign is back pain or abdominal pain. 80-year-old man presented with pain in the lower back and hip. He also complains of waking up in the night to go to the washroom and has urgency as well as dribbling. What is the most likely diagnosis? The answer would be D, prostate carcinoma. He is an old man. He has symptoms of dribbling, urgency and nocturia. The pain in back and hip could be due to metastasis. An elderly man undergoes pneumonectomy for lung cancer. After surgery, investigations show hyponatraemia. What is the cause of this change? It would be removal of hormonally active tumor. Small cell lung cancer has ectopic ACTH secretion, which stimulates aldosterone and causes sodium retention. When you remove this tumor, that drive to increase aldosterone has gone, and hence the patient now gets low sodium. A 79-year-old anorexic male complains of thirst and fatigue. He has symptoms of frequency, urgency and terminal dribbling. His urea and creatinine levels are high and he's anemic. Blood pressure is 165 over 95 millimeters mercury. What is the most probable diagnosis? The most likely answer here is prostate carcinoma. This patient has subacute symptoms of weight loss, thirst and fatigue, and terminal dribbling would indicate prostate problem. There may be either secondary involvement of kidneys giving rise to anemia, hypertension, urea and creatinine abnormalities. A 74-year-old smoker presented to his GP with cough and breathlessness. Examination revealed pigmentation of the oral mucosa, palms and soles. Blood tests show that he is diabetic and hypokalemic. What is the most probable diagnosis? This patient most likely has small cell lung carcinoma. He's old and he's been described to be a smoker. The answer would be ectopic ACTH secretion, which you see in small cell lung carcinoma. Now, hypokalemia is seen in Crohn's disease, but the primary feature is hypertension, and that is not described. There is no features of hypothyroidism, Cushing's or pseudo-Cushing's. The excess pigmentation is due to the ACTH secretion. 73-year-old woman has lymphadenopathy and splenomegaly. She feels well but is getting recurrent chest infections. Which picture you might find on a blood film? At this age of 73 years, it is likely that she will have excess of mature lymphocytes with the diagnosis of chronic lymphoid leukemia. The clue is the lymphadenopathy and splenomegaly. In myeloid leukemias, acute or chronic, you get granulocytes or blast cells. In acute lymphoid leukemia, which is common in childhood, you get abnormal immature lymphocytes, but you get mature lymphocytes in chronic lymphoid leukemia, which will be expected in this age.